Dr. Molly here again. I'm a professor at the University of Detroit Mercy. I teach in the College of Health Professions over there, and I'm one of the co-founders of Associates in Primary Care. One of the things we want to do at Associates in Primary Care is educate the public on their disease processes, because we believe that if patients understand their disease, they're more likely to be able to better manage that disease. This video in our diabetes series is going to focus on treatment options. So if you've been diagnosed with prediabetes or type 2 diabetes, how do you treat it? Step 2, we will usually start a patient on some medications. The first medication that we usually start almost everybody on is metformin. Metformin is a fantastic medication. It's not expensive. It's one of the first that came out in the diabetes categories. It's a hypoglycemic. It doesn't cause hypoglycemia. It lowers glucose levels, and it works. It's a little complicated. It works on several different angles, but it's a fantastic drug. Most people don't have any side effects with it, so we usually start out patients on metformin because it's really good to help manage that glucose. The next thing that we do, besides metformin is usually the first line. If the metformin is not effective at controlling those glucoses, keeping that glucose between 70 and 180, then there are about 5 or 6 other classes of oral medications that we can start prescribing for the patient. And so usually we'll leave them on metformin, then we'll start adding some of these different ones in the different kinds of categories. Some of the newer medications that are out now, the orals are the SGLT2s. You don't need to remember those big acronyms. But those are the Invokana, Farxiga, and Jardiance. And you probably heard those advertised on TV. Those are fantastic medications as well. This is the next generation of medications for type 2 diabetes that are coming out. And then the injectables that I'm sure you've heard about are the GLP-1s, is the Trulicity, Ozempic, and Mounjaro. Those are fantastic medications. 1, to help patients lose weight, and 2, to help control their glucose. They're fantastic at controlling those glucose levels. So those are some kinds of things that you might want to talk to your provider about. In some type 2 diabetic patients, they may also need insulin. If they are having a difficult time getting their glucose under control, then yes, we do also use insulin for type 2 diabetics, not just for the type 1s. Type 1 diabetics, they have to have insulin because their body doesn't make insulin. In type 2 that we're talking about here, they have all of these other oral medications that help reduce glucose level. They help control the production of glucose coming out of the liver. They have several different things that kind of help sort of fluff up the pancreas and the insulin that's not working very well.